Okay, so this is Nikki Norlock for Phoenix Nest, and we are back yet again with another BeaFibroFeenxRising Fibro Fog. It's real. BeaFibroFeenxRising Truth Talk, and we have yet another synchromistically gifted guest with us today. The lovely woman beside me, her name is Gail Robinson. She is from the Bay Area in California. She has worked for years as a psychotherapist, and not only has she worked with patients with chronic pain, she also suffers from chronic pain herself. So today we're going to talk to her about that, just so that you know where we're sitting. One of my favorite places in Costa Rica, Manny's House, which is a group of villas that's for rent. So if you're ever in Costa Rica and you're looking for an awesome place to stay with a fabulous host, I highly recommend it. Manny's House in Costa Rica. You can find it online. It's located between Ojochal and Uvita off the Costanera in Punta Arenas. So, thank you.
I'm glad to be here.
So much for coming and taking the time. You've got, wow, we've talked about so much since we met, so we're going to have to try and keep it really focused, I think. But one of the main connections I think that we had right away was we both suffer from chronic pain. We've both fought addiction. We've both struggled with depression, and we're both in the health and wellness industry, which, you know, a lot of people I think watching would be surprised to know that there are people like you and I out there working in the industry that are very willing to talk about their own challenges.
And it actually tends to be that most people that go into the healthcare field and psychotherapy are motivated to get the training because of their own issues. I mean, I've been interested in depression since college, and just always knew that I wanted to learn more about it and help other people with it.
So what have you found, because you've worked on this for years, you've dealt with this yourself for years, what have you found is important about the connection between chronic pain and depression?
Well, they really have a codependency relationship, in that if you're depressed, you tend to move less, or if you are in chronic pain, you tend to get depressed because you don't have the humph and the comfort to exercise, socialize, get out of bed. You're always just trying to manage that pain. So I think that they're very related, and I don't know exactly biochemically or brain chemistry wise, but I know there's something that hopefully they're working on to discover exactly what's happening with the synapses. You know, Nikki knows a lot more than I about the workings of fibromyalgia, where our nerves are overworking, and with depression, the synapses in the brain are under speaking to one another.
So there's a lack of communication.
Correct.
Basically, so in fibro, one of our issues is that our nerves are super hypersensitive, and there's also a disconnect in the communication where, you know, things that shouldn't hurt, like somebody touching you, actually causes you pain, and so I guess they're very closely related. And let's be honest about the effects of chronic pain. I mean, I haven't spoken about it on camera yet, but I mean, we might as well do that today too. I've struggled with you know, fighting thoughts of suicide for many years. Sometimes I think maybe the only reason I'm alive is because there were times when I was too exhausted to actually go and get the bottle of pills, and so I'm certainly not in any way, shape, or form through the work that I'm doing making light of or taking away from the importance of the emotional impact that this disease has on people's lives, or any chronic pain disease for that matter. It literally robs you of the will to live, because why would you want to live for the next 30-40 years if you experience pain every day?
And likewise with depressives, we often don't have the motivation to even think about a plan, or, you know, too much work to get out the rope or whatever. So it's one thing. Well, I'll just do a little aside. I was trained very Freudianly, where you were encouraged not to talk as a therapist to your patients, not to self-disclose. And so that's what I followed for a very short time, maybe 6 months, and I found myself, patients and clients just not feeling as willing to open up as when I said, I've suffered from depression since I was 16, or maybe before even. But I know it's increased and increased, and then the fibromyalgia kicked in, and I would treat that with just a lot of exercise. But I didn't go on to antidepressants till my 30s, and because I was trained really to be anti-medication. But I'm finding now the first 3 weeks or less, first week that I was on antidepressants, I remember saying to myself, is this how other people see the world? You can actually think about weeding that garden? And it worked really quickly for me, but I've found that many other patients, people react, when I started there were a very limited number of medications.
Right.
And now they've really done a lot of research and study and finding you have to be very patient and see what works and what doesn't. And you might have to be on them your whole life, and you might be able to go off. The thing about Prozac, which I was on, I've just taken a little break from it to do my own experiment, is that it has a long half-life. That means it stays in your system so long that you go off of it and you feel fine for 7 or 8 days, and then you start to just go, the black cloud comes back.
Right.
And then you stop exercising as much, and somehow my chronic pain increases. And I don't know if that's lack of exercise, but my hunch is that it's related biochemically and with the brain chemistry.
Right. So just for people listening, when somebody says to you, and here's something that we hear a lot in the fibromyalgia community, is that, oh, that disease is just in your head. It partially is, meaning that it actually is related to the way that your brain works. It is related to the way that your nerves work, and your nerves are all connected up through your spinal cord from all the different parts of your body, and they go up through your brain, and that's where everything kind of clicks in. So yes, there are very real physical results to that, to both fibromyalgia and to depression. And that's something that we have to cover as well, is that, listen, depression is not somebody not wanting to do something or just feeling down. It's a serious disease. It causes fatigue. It causes an inability to think clearly. It causes lack of motivation. It causes you to lose track of what your priorities are, what's important. It's literally impossible to answer that phone when somebody calls to check on you just because you're looking at the phone, and something in you doesn't want to pick it up. And fibromyalgia, when you're in the flare-up, is very similar to that. So there has to be a close tie to it. And the people who've watched my work know that I'm an advocate for natural healing as much as possible. Gail, you are too. But here's the thing. There's a time and a place for medication. There's a time and a place when you have to give your body, your mind, your soul a break. If you want to go down the natural health and wellness path, right, use the medication to transition you to a healthier lifestyle of living, because I guarantee you, if you're not taking the medication and you're on the pain, or you're not on the pain pills and you're in pain and you're depressed, you're not going to want to drink that extra glass of water. You're not going to want to cut up that fruit. You're going to go straight to the junk food, and you're not going to want to put in the effort. So use it not as something to rely on for the rest of your life, but as a tool that you can use to transition to a healthier lifestyle over time, being gentle with yourself, being patient, as you said, so that you can have that end goal and not feel pressured. And some people can't get off the medication at all, and that's a reality, and we have to face that too.
But the reality is also, if you can see a physician or a Eastern health practitioner to work with as well, because they can't prescribe some of the drugs we're talking about, just by getting rid of some of your pain and some of your depression, motivates you to get on your bicycle or to walk with friends, socialize. The more you socialize, someone says, oh, I'm going to walk again tomorrow. Do you want to go tomorrow? But if you're in your house with suffering from depression and pain, you don't get those recurrent, that social network that encourages you to do it again tomorrow. It's very
Yeah.
important to make a commitment, but if you don't have that first one. So letting go of some of the depression, suddenly you go, oh yeah, I'll go on a bike ride, where before, yeah, I would say, well, I actually wouldn't even have the conversation because I wouldn't be out there. When I had young children, of course, I was very motivated to just take care of them and get everything done, but and just the movement itself. My dissertation was on movement and depression. Very little information about that when I was getting my degree in the early 80s. But now, it's been proven that you move, your norepinephrine goes in, your serotonin kicks in, and with depression, you've got these two nerve endings, but you're lacking the substance that helps them fire and receive the message.
Right.
Where when you take antidepressants or exercise or both, it raises the endorphins and it creates, antidepressants usually make the serotonin stay around longer, so it's not, it just disappears. It's a combination. It's complicated. I've been doing this for over 30 years, trial and error. I had very few physicians really do anything except when I prescribe, but now living in the Bay Area, California, where I do, it's become much more practice. In fact, the large medical institution, Kaiser Permanente, that I am a member of, encourages. They have free yoga classes for patients. They have support groups, which I'll talk about maybe in a minute. The importance of having like-minded people around you that suffer from the same way, because there's an embarrassment and a denial. You don't want to tell your friends, oh, I ache. Because, it's one thing if you have a scar and 18 stitches, they'll help you out. If you just say, I ache and I hurt, and they go, get over it.
You tapped right into, I think, what the biggest heartbreak, I think, and I'm going to cry, because it's the biggest struggle for people with fibromyalgia, is that nobody can see the pain, and so nobody believes. And I'm blessed in that I am surrounded with healers and amazing individuals who are a massive support system for me, and they believe, and they've done their research, and they know what this disease is. But it breaks my heart to think about the people out there who don't have the support, because I understand husbands look at their wives and they don't understand why they can't touch them, and they don't understand why a hug hurts, and it doesn't make any sense, and it's scary for the patient, it's scary for the family, and it gets so bad that it's to the point where somebody with fibromyalgia we're the best liars on the planet. We're so good at faking it. That's what we do best. We fake it. We smile. We nod. We pretend that we're okay.
We make up excuses.
And we're not okay. We're not okay. We can be okay. I'm okay now. That's what this series is all about, but there are times in my life when I haven't been okay. And if not for the people in my life, if not for my support system, I would not be here now, because I didn't want to do it anymore. There's lots of times when I've called friends and gone, I can't do it anymore. I've told my husband that I can't do it anymore. If I have to go through another winter of pain, I don't know what's going to happen to me, because I don't have the courage.
You're really having it, to some extent, no life anyway. It's like suicide without killing yourself. I mean, you feel dead to all the activities you maybe loved and enjoyed and thrived on. I was a major athlete as a kid. I didn't have this, and so once you stop exercising and you get some aging, and I've got rheumatoid arthritis, and I've got inflammatory stuff going on. But that happened, quite a while after. I should have seen it in some ways. If I get stung by anything, my arm will swell. I'm just very reactive to any kind of toxin, where other people aren't. But unless you talk to people, and that's why also the research is showing that support groups, or small groups of 2 and 3 people that say, I'll support you, you'll support me, but you have to be able to speak out loud and admit what you have. be it substance abuse. But that's very hard to do because a lot of people that don't have it will just completely cut you off. You'll lose that person as a friend. Well, they might have been a friend to a certain extent, but if you don't have it, you really can't fully understand it. Empathy can go so far, but if you don't, when you look at a person that does not look like they're in pain, I try to tell people, don't shake my hand too hard.
Yes, you do. You do tell us.
Well, but people
forget.
Yeah, my partner will say, "You'll just grab something out of my hand," and I can hear, my hand, wrist will swell. But he can just pull anything around, lug ice chest into the boat, but I just can't do it. And so your muscles get a little weaker, so we've got to build up slowly getting some strength back. That's where I feel like all kinds of things like yoga, Rosen method, stretch, Rosen work, where you do slow stretching and bending. And with a practitioner that knows what this is about.
Absolutely.
If a practitioner doesn't say in the first couple sessions, or I'll actually interview them a little bit, I have this, and this, and they go, so do I. And my yoga teacher said, and I'm a cancer survivor and a recovering alcoholic. Go, oh, I think maybe you could help me.
And that's a big thing, that we really have to be diligent in our own self-care. We have to own, first of all, our illness. We have to take care and control of our health and wellness adventure. And we have to educate ourselves. And we cannot any longer say it's okay to a doctor or even a naturopathic person who is not in total support, alignment, understanding, and compassion of our current position. That's not okay. Find a new doctor. End of story. I'm sorry. It's got to be that way. Now, this is Costa Rica, and unexpectedly, it's starting to rain a tad, so we're going to move the camera into where there's shelter. We're going to take a quick break, and when we come back, I think I'd like to talk about your experiences with abuse and alcohol abuse. I'll put that out there now, and hypnotherapy. So we'll be back in a moment.